Hello, Central Ohio. Kevin Boyce here, your favorite county commissioner. I don't know about that. I got two others on here, so I don't know about that. But I'm so excited today. It is February, and you know what that means. It's Black History Month. We've got a lot to talk about in just a short amount of time to do it. But I got some great guests on the phone. First, I mean on the phone, on the computer here. First, I've got with me my colleagues. I'm gonna start with my favorite colleague. Marilyn Brown. Let me introduce her. Marilyn, waved everybody. And then my second favorite colleague on the commission, and that's John O'Grady. So good to have my colleagues here with me. And we've been doing a lot around diversity and inclusion in Franklin County. So I'm sure they're going to have a lot to say and a lot to talk about. But we also have some special guests with us today. Let me begin with my very good friend, longtime colleague, mentor in all things Central Ohio, former state senator Charleta Tavares. She's currently the CEO of PrimaryOne Healthcare Agency, which is I never get these right. What is it? HQFC?
No, it's FQHC,
I
Federally
never get it
Qualified
right.
Health Center.
FQHC. And so we're going to hear more about that a little bit later. I was so glad to have you. And if you get a chance, go on Columbus City Council's Instagram page and check out the pictures that they posted of Senator Tavares. Great pictures, trust me. Next, we have with us Charles Hillman. Charles Hillman is the CEO and president of the Columbus Metropolitan Housing Agency and so authority rather. And so good to have you too, my friend. He's dressed down a little bit today for us, y'all. So you know that he's normally a little more flamboyant.
Right. But we don't want the focus to be on our appearance. We want it to be on our issue today. So that's what.
Well, it can be both. You know, it can be both. You know, I wore
well,
orange tie.
The young man over here with the suspenders and you in the orange tie really do bother me, but I'll get over it.
I didn't want to say anything and flash that out here, but you know. And then
I had to do a double take there for a second. I didn't recognize Charles being dressed.
I know. That's what I said, John. I said the same thing. I said, you know, what is going on with his dress down? He said he was trying to go county look, the county, you know, service look. So, you know.
Yeah.
And then finally, certainly last but not least, we have Dr. Hasan Jeffries here today, who's a PhD in American history professor at the Ohio State University, teaching civil rights and an author of many, many things, but civil rights and Black power in Alabama's Black Belt and in the shadow of civil rights. So I'm excited to hear more about that today. But let's just dive right into it. And I'm gonna ask my colleagues to just join me in the discussion as much as you want. If you think of a question to ask, just jump right on in and do it. I'm just trying to get us started. Let me just set the stage. There's a young lady, African-American woman by the name of Heather McGee. And she sort of coined the discussion, you know, is racism bad for the economy? Is racism bad for the economy? And she talks about two things that stood out to me that I want to share, that she gave really good examples of racism being bad for the economy and basically saying that there is a cost to racism. She talks about a public pool by the name of Oak Park Pool in Montgomery, Alabama. She said, you know, in Montgomery, Alabama, this pool was one of the shining centers of strength for the community. People would come to meet there, certainly swim. The place was lined with trees. It was certainly a gathering place for all. She said, but then something happened in January of 1959. A federal court ruled that they had to make the pool inclusive, you know, so because it was a whites only pool. And so in 1959, the federal court ruled it had to be made inclusive and desegregated, and so that everybody could attend. And remember, everybody was paying for the pool because it was a taxpayer-funded pool. But so 1959, they ruled that it had to be desegregated. And instead of opening the pool up to everybody, you know what they did in Montgomery, Alabama? They drained the pool. They shut it down. They said, you know, if it can't be whites only, nobody goes. And so think of that and the economic implications on a number of levels of just that. And then finally, she talks about, which I think was really great. John, you'll like this. She talked about the Lehman Brothers and the crash of the economy in 2008. And if you recall, I'm paraphrasing all this, long story short, if you recall, you remember, it was all rooted around the collapse of mortgage-backed securities. If you recall, mortgage-backed securities were instruments that were created to help essentially give borrowers subprime loans. Now, what was key about the mortgage-backed securities was it was great if you were an investor. You know, the returns were tremendous, but it was bad if you were a borrower because it had these components in it that would essentially make a balloon payment, or it had a armed variable rate where, you know, you started off in good shape, but then you got to the end and it blew up, or you couldn't even refinance because of the prepayment penalties. And so it was really a disaster. But here's what the collapse of 2008 cost us. And I loved how she summarized this. She said, that collapse alone on mortgage-backed securities cost our economy 19 trillion in lost wealth. 19 trillion in lost wealth. And by the way, the folks who had those mortgage-backed securities, minorities, you know, Black people, Hispanics, you know, and so forth and so on. It was supposed to make home ownership a little more available to folks, and ended up crashing our economy. 8 million jobs lost, and a home ownership rate that has never recovered. So let me start with the ladies. Charleta, Marilyn, talk about the cost of racism. I gave you some examples, but I know Charleta's going to want to talk about some of it in healthcare, and Marilyn, she can talk about it across the board on so many levels. And so let me just open up. We'll start with Marilyn and Charleta, whoever wants to go first.
Well, I know from my work in Greater Cleveland, the cost of racism was huge. We were in a very segregated housing situation. Greater Cleveland in the 80s and 90s was one of the most segregated communities in the country. And we were working to break down those segregated housing patterns so that anybody that could afford a home could buy a home anywhere throughout Greater Cleveland. And doing that allowed for a truly open market that allowed for Black families to move where they wanted to be, where their kids wanted to be in school, to live in communities where they would not have considered moving in because they were never welcome before, but could afford to live in, but just never considered living in those areas. And for white families to move into communities of color where they would never have considered living before, and they moved into those communities or moved back to those communities. And there was a huge economic benefit to having the communities be more economically stable and having families of all colors live in where they wanted to live, where they could afford to live. And, you know, that was in the 80s, and it was an experiment that got Ford Foundation support. Mm-hmm. And we really had some good things going on. It lasted until the 2000s, when I was already here in Columbus, where nobody was really talking about these issues of segregation and race relations issues and racism and fair housing and things like that. So I'm interested to hear what everybody else's experiences were, but I was surprised nobody was talking about these issues at the time we moved to Columbus.
Yeah, I tell you the thing too, that I don't know if there's a way to put a value on diversity in terms of culture, in terms of interaction and generations of kids growing up from different backgrounds and that kind of thing together. But there's got to be some kind of research out there that puts the value on just that level of engagement.
Commissioner Boyce, I think on that issue, I think the two examples you gave with the public pool and the subprime lending to individuals, African Americans and people of color, poor Caucasians are two perfect examples of how you can measure the cost of racism, that we would rather do without a pool for the entire community and suffer the entire community rather than have African American men, women, and children use the same pool. The same goes for the subprime lending. As you know, I've spent a lot of years in housing policy, formerly on Columbus City Council and chair of the housing committee. The subprime lending issue goes back a long time. I mean, even the VA loans, federal policy that prohibited our African American soldiers from coming back and using the VA's program that was set up for veterans to buy houses. That has had a tremendous cost on the wealth of African American families, on the poverty rates of African American families, on the neighborhoods and the lack of services that African Americans have been subjected to, whether it's violence, whether it's environmental and climate issues within those neighborhoods that they've been relegated to. And so you have that taking place generation after generation. And then in addition, the cost of healthcare. You know, we've been focused here in Franklin County, and I thank our Franklin County commissioners for your focus on infant mortality. And now we're discussing the issue of maternal and infant mortality in total because, you know, it's had an impact on African American women and babies. The impact on our total economy and how much we're spending for NICU babies and babies who are dying means that employers don't have those employees in the future. It means that we're paying tremendous costs, not only to the individual family, but to the community as a whole, that we don't have those Black and brown children growing up as healthy young people into adulthood so that they are ready to take the jobs, go on to college, and then they are invested in our communities. They are a part of sustaining our communities. And then the cost of healthcare in total. When you have babies that are born on public assistance, moms and children who are a part of our Medicaid program, who are a part of our SNAP programs. We have children who are in our child welfare system, disproportionately African American children, that for some reason they're not wanted. For some reason they've been taken out of the home. In many cases due to biases in how people live. And so the cost is to all of us. It may be direct, it may be indirect, but all of us are paying for it today and for years in the past.
And I would just add too that it's generational too. You know, when you sort of you are raised in an environment, sometimes it can be difficult to see another lifestyle or see, you know, be able to go to college or different things like that, you know, and so it just becomes cyclical, you know, almost in a family, and there's a cost to that as well, because you still have those people, generations pulling on the system. John, Charles, and then we'll allow Dr. Jeffries to bring it home. But John, what's your thoughts on this conversation?
Let me make sure I get myself off mute here. So the comments that Charleta and Senator Tavares has brought up, and those are all the things that we've been talking about over the last 2 or 3 years as we've done the poverty research, but certainly as we've, you know, just in the entire time that, you know, I've been on the board of county commissioners, the example that you used of the swimming pool in Montgomery, Alabama, and, you know, interesting. I've been to Montgomery, Alabama, and that was not at all, an unexpected response. But you know, when Charleta says that, you know, this is a reaction, or that we're all paying for this, or that this is all of our problem, it's the entire community's issue. when 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 kids are struggling, when black and brown babies and black and brown children are being left behind generationally, as you say, Kevin, the thing that I oftentimes hear is, then you have, families or men and women of, in the suburbs, complaining, that they are the ones that they have to pay, they have to help, their tax dollars, or why are we spending their tax dollars to help do these programs that we fund, that you and I and Maryland fund all the time, to help kids and to help families, to try to help fix these, not fix, but to help try to address these issues. And we get complaints, we get letters written or emails written to our offices, wondering why we do this. Well, we're doing this because it's helping the entire community, because we can't afford to let any of our residents fall behind. We can't afford to let, if we don't address these issues, we found that when we started doing the poverty research, and the very first thing we found was that racism is the number one issue when it comes to poverty in this community, in all communities. And so it gets frustrating when we try to address the issues that we're faced with in our community, and racism's at the root of all of at the majority of the issues that we're trying to deal with in health and human services, and then we get a rising number of complaints all the time because we're trying to address it. So.
But to your point, though, Commissioner O'Grady, that's why we declared racism as a public health crisis, to really peel back the layers and allow for the conversation to recognize the impact of racism, but B, the declaration as a crisis means that it expands over a lot of different areas. And so we're in a pandemic, and we see those numbers consistent, the disparities consistent with the pandemic numbers, whether it's getting tested or getting the shot. And so we make the effort with the declaring racism as a public health crisis allows us to be conscientious about how we are distributing the vaccine, where we're distributing the vaccine, and who's getting it. And that is an important step for our community.
And I would also, excuse me, John, I would also say making racism as a core principle of ours and dealing with racism as a core principle of ours is one of the things that allows us to do the things internally and externally in the community that allow us to get at this issue that really keeps the community from being all it can be. Because unless everybody is doing the best that we can have people do, and people are feeling like they're being listened to and given an opportunity to do better than they thought they could do, nobody's going to be the best they can be. And we can't thrive as a community unless everybody is having the opportunities to do the best they can.
Agree. John, were you going to say something?
Well, we're also seeing, it's been an issue in the rollout of the vaccine. It's been an issue in housing, which is great to have Charles Hillman on here today. It's been an issue in healthcare, so it's great to have Charleta with us today. It's been an issue in education. It's an issue in transportation. It's an issue. It's an issue across the board. It's an issue in banking. It's an issue. It's an issue in just about every facet of society, and it's an issue as we try to address the inequities and try to figure out how to help people go from poverty to the middle class. In every aspect of that work that we're doing, there's an element of racism, and so we've seen it across the board. So I'm sorry. Charles, we should let Charles chime in.
Charles, this is your specialty area, man. This housing.
Yeah, so let me start by saying a couple things. Number one, thank you, commissioners, for these important conversations. Thank you for declaring racism as an issue in our community. That's groundbreaking in and of itself. And so, which leads us to these very difficult conversations like the cost of racism in our communities. And so I think it's important to note from my seat, affordable housing is the hottest topic in every community across the United States. And it's because of racist policies that were put in place many years ago, like redlining, which devalued communities like the Near East Side, like one strike you're out policies, which evicted people from housing if they ever knew somebody to smoke the joint, basically. And frankly, unfortunately,
none of us know anybody that smoked a joint. Just wanted to say that. Right. None of us know anything. I don't know anybody or anywhere.
No. Ever. Well, I do. And so, and I say that because, these things, brown and black people, just as simple as that. I mean, they took racism to make marijuana a deviant. And, until majority liked it, now it became a medical thing. And so I think, there are multiple examples of how racism has impacted and continues to impact our community. But I think the biggest one is, it is 2021 and we're still talking about it. Yeah. And I think that's the biggest cost. We should be on here talking about a whole lot of other stuff other than why, because I'm black and or brown, you treat me different. Or because I'm black and I'm brown, you now have a right not to let me live in your community. Because I'm black and I'm brown, now I don't have a right to speak out. Because I'm black and I'm brown, now you can say anything about me and I have to accept it. And those are the costs of racism. It has been devastating to our community, and our people have had to fight to try to figure this out. And that's why I commend you, commissioners, for taking this on, because black and brown people cannot solve this. This is going to be the responsibility of white folk who put these policies in place to correct them.
Yeah, you said that so well, because I'm telling you, we have made a lot of ground since I've been a commissioner, but it's really because, if there was a group think, if there was a such thing as groupthink, we've accomplished that, because we all see it very much the same way. My two colleagues, one has a Jewish background, the other one has an Irish background, and so they know discrimination in their own histories and they understand it to the core. But this is the perfect setup for Dr. Jeffries. He's our resident expert on civil rights and some history. Give us your take on this sort of 2021 lens that Charles was talking about with regards to racism and just where are we in the country now in the pandemic and what we're seeing and what do you see at OSU?
I see OSU, a lot of kids smoking marijuana, but that's a separate it's a conversation for a different day.
It's medicinal, right? Though, but it's medicinal.
It's medicinal, right?
It is.
And they don't have many cops knocking on those doors, but that's a separate story.
A lot of kids got cataract these days.
Apparently so. Apparently so. But this question, Commissioners and Commissioner Boyce, I really appreciate the invitation and share some thoughts and ideas. This has been a marvelous conversation so far, and just listen so far, and just listening to the insights that have been offered. I'm struck by this idea of, and the example that you started with, you shared of the pool closing. And of course, we know certainly that was a community cost, and to a certain extent, that's an inconvenience, but it extended far beyond that when we think about the response to efforts to create equality. Not only were pools closed, whole school districts, public school districts were closed in Arkansas and Virginia and elsewhere. I mean, so, you talk about a cost and the what white people were willing to do and sacrifice in terms of their own communities to keep equality, to keep Black folk from moving in, to keep Black folk from having what was rightfully theirs as American citizens and taxpayers is almost beyond belief. What they were willing to sacrifice in terms of, and who they were willing to sacrifice. Not only Black folk, but they were willing to sacrifice their own kids to keep them from sitting next to white people. And now we see that in extreme form in, Montgomery, Alabama, or Charlottesville, Virginia. But you don't have to look very far, from Columbus, Ohio, to see the ways in which we practice the same things going forward over the last half century. So does racism have a cost? Yeah, because poverty is expensive. Right?
Yep.
It's very expensive, not only to be poor and live poor, but it's expensive for society as a whole. Being unhealthy, being sick is expensive, right? If you are the person who is sick, but then also, as it already has been explained, and Senator Tavares knows better than any of us here, to care for those who are ill. So the idea that racism only, if it exists at all, and clearly it exists, that it is something that just Black folk have to deal with, is really a myth and a misnomer. One, because the idea of racism, and more specifically white supremacy, is something that exists in the white mind primarily, right? Black folk got to deal with it, right? But it's something that is in the white mind. And it is also something that's not new. I mean, this is why it's so hard to deal with, because we've been wrestling with it for 400 years, right? This isn't just sort of America's original sin. This is America's origin, right? And this is dating back from slavery to the present. And I know in dealing with sort of students at Ohio State, the students I get, they come in my class and they're very excited because they feel Ohio was on the right side of history. We came into the state, we were free, we had to deal with racism. I'm like, yeah, Ohio was on the right side of history for the wrong reasons, right? Because they wanted to keep Black folk out, right? They didn't want enslaved folk here, they want to keep Black folk out. And then when Black folk came in, and this establishes the pattern, right? We talked about housing, we talked about healthcare, but we also got to talk about labor and working. When you discriminate against workers, what you actually do is depress wages as a whole. So the cost to white workers, whether you were a Jewish immigrant or an Irish immigrant or Italian immigrant, was real because of the depression of wages, the refusal to let African Americans into unions, and then creating this surplus labor force that could then depress wages. So across the board, we know history tells us, and we're still dealing with it today in every one of these different areas that we've already talked about, that racism is real. Racism has a devastating impact on communities of color, but racism also has a detrimental impact on society at whole by every measurable standard.
Man, I think you said that better than anybody.
Now, I unmuted because I'm going to tell you that was impressive. Thank you.
Yeah. And I'm really grateful that we've got you on. So we're going to get some more questions in, but I want to give some shout outs to Kelly Johnson with the Office of Aging, who's watching and tuning in. Thank you, Kelly, for joining us. Carolina Trindage with the Diversity, Equity, and Inclusion Administrator. Thank you for tuning in. Connie Hanna, that's my cousin. Thanks, cuz. Appreciate you tuning in. Heather Johnson and Kathy Wheeler, thank you so much for tuning in. Let me just open up to the floor and feel free to just have a discussion, maybe have some other questions, but Black Lives Matter, and let's talk law enforcement and Black Lives Matter and all the things that we saw in the summer of 2020. What's the cost in law enforcement? What is the cost to the psyche of the public, not just for Black people, but for white people too? What are we seeing? Is our country changing? Are we seeing right before our eyes a shift in history, a new chapter in history? And is Black Lives Matter going to have its own chapter in this history, like the Civil Rights Movement did, and various other aspects of it did? Let me just open up to the floor. Anybody?
Kevin, I think that it will absolutely make changes to our history, our collective history. It has already made changes. There are Black, brown, white, red, LGBTQ plus communities coming together to say, we agree that Black lives matter and we want to address the systemic racism in our criminal justice system from decision to arrest until sentencing. And we don't have to go very far to see that studies have already been completed. I don't know whether anyone else on the panel remembers the Racial Justice Commission that former Chief Justice in Ohio, Moyer, commissioned to really take a look at our criminal justice system. This was back in the 90s. And the decision that came out, the report that came out in early 2000, basically said all throughout the criminal justice system, from decision to arrest and what to arrest for, and what charges would be thrown at the defendant or the perpetrator, supposed perpetrator, all the way up to the kind of defense that individual would have, the sentence that would be handed out, and how they were treated in the criminal justice system is based on discriminatory and racist policies. And so that came out in the early 2000s. Have we done anything to address it? No. There are some laws that have been passed to ameliorate some of the issues, but still we are not where we need to be. And we still see discrimination in how African Americans, Black individuals are treated in decisions of where they can even walk, where they can even drive, and even in Franklin County. I hear it from former constituents and now friends and colleagues of mine that there are certain communities in Franklin County where an African American male is followed by law enforcement simply because he's driving in a community that they don't think he or she should be in. The same thing happens with walking. Will this make a difference? Only if good people stand up and do something. Only if all of us who are on this Zoom call today continue this conversation, but then continue with actions to address the criminal justice system and all of the other systems that we've talked about.
And let me just throw in a couple points to further reiterate that, you know, Ohio is made up of 12% African Americans roughly, which would be 6% men and 6% women. But so 6% African American men make up the population, yet our correctional institutions make up over about 50% of the prisoners are African American males. Let me go one step further, and this is the cost of racism. If you look at households, and I'm going to get this a little bit wrong because I'm just off the top of my head, but it's close. And there's a stat that says, you know, if you are a Asian family, if you're a white family, you are, I think, maybe 25% are head by single parents. If you are Asian family, I think it's like, you know, even higher. If you are a Hispanic family, I think it's 40%. If you're a Black family, 70% of Black families are headed by single parents, of which the vast majority, over 90-something%, are women. And then I connect that with the men who are in prison. And so you just see the pattern. And so the question though is, are we seeing change in the country right now? You know, there's a lot of discussion, you know, and some people have said that Trump's presidency may have actually moved the needle in the right direction, believe it or not, because it shook society up. So are we changing? I think John's going to say something.
Well, I think Trump's presidency did both. It moved the needle in the right direction in terms of, you asked the question, is the BLM movement, you know, is it a real thing or not a real thing, but is it validated, or I'm not sure how you worded it, but yeah, I think the BLM movement has been very powerful. It's a very, it's here. I think it's here to stay. I think it's certainly, woke the country up to to this issue. I think Trump's presidency woke the country up to this issue. I think Trump's presidency also made it okay for, racist white meatheads to do say whatever the hell they want, do whatever the hell they want, and act the way they wanted to. Kevin, you and I were on a trip. We were in Toronto together when Charlottesville happened. Mm-hmm. I remember you and I and former Mayor Coleman were together when that happened, and I was dumbfounded. I couldn't believe that. And as a matter of fact, we had been invited to the White House by President Trump, and I remember saying, "There's no," when he said there's fine people on both sides of this issue, and I remember looking at you and saying, "There is no chance I'm going to this guy's White House." Yeah. Not when it's okay for him to say something like that. The other thing that's been driving me crazy lately is when we have people in this country, we have politicians in this country, and we have people on the other side of the aisle, like Representative Jordan and others, who try to equate Senator Rand Paul from Kentucky, people who try to equate the unrest and the that went on last summer because of the George Floyd incident throughout the United States and what happened on January 6th. There is absolutely no way that you can equate those two instances and think that there's anything that they have anything to do with each other. And but when you have what's been going on politically in this country, what was created by the president, the former president, then that kind of stuff happens, and he makes it. His presidency made it okay for in their mind for a certain fringe white group of white folks to think it's okay for that stuff, and it's just not. It shouldn't be, and so he made racism okay in their minds, and that's just. But he also then, as you said, the point you pointed out, he made the BLM movement. He helped that. So.
I
But
mean,
yes,
I don't think he
things
mentioned
better.
it, but
And I appreciate the commissioner's response. Yes, things are better. Yes, things are getting better. The fact that we're having this conversation, the fact that leaders like yourselves who govern policies and practices in our own organizations have now changed them to be non-discriminatory any further are important things. We've instituted policies here at CMHA in our hiring practices. We were heavily criticized for doing that initially, but we have to see, we have a Rudy rule. We have to look at a certain number of minority candidates before we move to a majority candidate. And the reason why is because we couldn't get to minority candidates because we couldn't. And so we had to seek and recruit because they weren't being successful at our organization in particular. We now have housing policies. We now develop in areas of opportunity. We no longer, not in my backyard, we accept that. We've increased our housing choice voucher program to make sure people have housing choices in all communities in Franklin County. I am a proud resident of Bexley, and I'm proud to tell you they have instituted a policy where you can no longer discriminate based on income. So now our voucher can be used in Bexley because before this, you couldn't. And so there are things that are moving forward. And so I just think we have a momentum, we have a moment in our time. And as Charleta said, we must capitalize, we must take advantage of these moments. And this is one of them. And yes, our history will be changed as a result of Black Lives Matter.
yeah, I agree. Who else? Marilyn?
I think, this is a moment in time. And I think history is on our side in this moment. And I think the momentum is here for change. You can't have a conversation that's not about race and how to eliminate racism in this community right now. And I think that's good and that's healthy. It's the first time since I've been here that this is happening. And I think we need to capitalize on it and use it for good. And I think we can make change in how we do business, how we do our work. And every institution in this community can make those changes. But I also think we need to look at the federal policies, the state policies and laws that cause this historical and structural racism and start breaking down those barriers that have caused problems for the Black community for so many years. Charleta mentioned, Black GIs could not get the GI Bill, could not buy homes like white GIs could when they got out of the service. That's but one thing there's been so many issues that have not been equal for Black families to buy homes, to get lending. Those issues still need to be taken care of at the federal level, and we need to push and push and push to get those policies changed, and we can't stop now.
Yeah, I mean, before we go to you, Dr. Jeffries, I want to give a shout out to Demetria Peacher, who says this is an amazing discussion. Those are her exact words, amazing discussion. Jonathan Bentley says, great discussion, everyone. Heather Johnson says, hey, $336 million to police our Black and brown folks, but not the same amount for affordable housing. And so there's something to be talked about. We'll come back around to that. Dr. Jeffries, I mean, you know, are we seeing history before our eyes, really? And as I think someone said, are we on the right side? Are we headed in the right direction? And you're on the ground floor of it because you're at OSU, where you see the young people, the next generation, and what you're seeing there. Tell us, what are you seeing at OSU?
Well, I'm excited by the energy among young people, among the generation that's coming up. I've seen it in measurable ways, just in the enrollment in my classes. Courses on civil rights, for example, and Black Power.
It's more diverse now? You're starting to see more diverse.
Well, no. Ohio State is very white.
Okay.
That has not changed, right?
Okay.
So all my classes are majority white. You know, we civil rights, Black Power is always going to be white. It's just more of them. So we go from 20 in 2016.
Other than the football team.
Oh, the football, right. Well, that's a matter of recruiting. Right. We got that. So look at more globally. But the numbers, right? I mean, just the level of interest, right? So 20 students, 25 students in civil rights 4 years ago, 120 students in the fall, right? I mean, so the kids are coming in with a different level of interest. It's not just taking the class because it fits their work schedule. They're taking the class because they're trying to figure out how to change the world. So that's exciting. That's important. What we saw last summer, not only here in Columbus, but around the world, with literally tens of millions of people taken to the streets, was historic just in terms of numbers. That was the largest public demonstrations in U.S. history. The largest demonstration, march, protest during the civil rights era was 250,000 people. That was the March on Washington. That was 8 hours. We were talking about 8 months of people taken to the streets in varying degrees. So it has already made history. I think it's important to note, though, that we have to be cautious in general as we talk about progress, that we push back against the myth of perpetual progress. I mean, one of the things that the Trump era has made clear, I hope, to people is that, so the arc of the moral universe is long, but it doesn't always bend towards justice. It only bends towards justice if there are people willing to exert a force. In the context of American history, the default for that arc is towards injustice. That's just the reality of the history. What we have seen is the way in which that arc has deviated, not towards some abnormal state, but has actually moved back towards what the status quo was. And so we have to exert this pressure to move that arc towards justice. So it's critically important that we understand that whatever progress is made will only be as a result of people making progress, both inside government and outside government, ordinary people and those we have elected to office. And if I could just say one more thing, because a number of issues came up. We were talking about sort of criminal justice, and it is expensive as heck to warehouse people. Mass incarceration costs money, and it's not just the end of it, right? I mean, if you're talking about 50% Black males in prison, you're taking productive people out of society, right? And you're warehousing them and you're making them unproductive. And when they come back, you're making it difficult for them to become productive again. All of that is a drain on society. All of that costs money, right? That's one thing. The other thing is, mass incarceration begins with mass arrests. And so we're pumping money into police departments that then, are fueling this machine that is leading to arrests. I mean, so all of that is connected. All of that has a cost, right? If there are some things that we decriminalize, then we don't need more, but we don't need to keep investing and over-investing in policing in the ways in which we have done. And then this last point, racism has a cost, but racism has stuck around because racism has been profitable to a number of people. And it is important that we recognize that, whether we're talking about sort of mass incarceration and private industries and those who are, a part of this mass incarceration complex, whether it's education and charter school. I mean, somebody's making money off of this. They've been making money for 400 years. And so until we cut that off and we say racism is no longer profitable, then, or make it so that it's no longer profitable, then I think we can really move in a different direction.
Man, well said, well said. We got Dr. Patrice Palmer. Patrice, we all love you. Good to see you. She says this is a powerful conversation. Sean Carter, thanks so much for joining us. And LaGreta Holloway from OBM, and Joy Bibbins, our Deputy County Administrator. Thank you so much for joining us. When you talk about the impact of institutional racism, I'm reading this book right now. I don't know if y'all can see this. It's called The Color of Money, Black Banks and the Racial Wealth Gap. And it's a really good book about Black banking in America. And it really starts in the Civil War, right after the Civil War, during the Civil War. The federal government, Congress, actually established the first Black bank because soldiers didn't have anywhere to put their money. The white banks wouldn't even take the soldiers' money who were fighting in the Civil War. So they created a Black bank. And but here's the crazy thing, you're talking about being the profitable element of this. So after the Civil War, in that bank, there was about $200,000 of Black soldiers' money in the bank that never got claimed. And they just took that money. And again, the idea, the feds took that money. And then the idea was, that there's some of this, 40 acres, the whole 40 acres and a mule kind of, so that, they were given the 40 acres, but then it was taken back, even because they said, well, you can't be landowners. You don't have bank accounts. I mean, the whole thing is, you talk about profitability. This is the thing that we have to erase. And these are the pieces. I'm going to throw this out, and I'm going to start with you, Dr. Jeffries, since you kind of keep coming to you last. I'm going to have you start off. Keep in mind, we've got about 13 minutes, so we want to end on time. But, structural racism, as you see it, and give it from the lens of some of your writings, and teach us something here about civil rights. If you had a couple of minutes to just educate all of us watching, all of us sit on the panel with you, educate us about what institutional racism is. And I'm going to say to my colleagues, I want them to talk about maybe when we first got together and had the conversation around racism and poverty, and we were very deliberate about it was a big issue that was huge and how tough it was going to be. And so my colleagues maybe talk about that conversation, if you recall it, of how we sort of convene in this conversation about what we're doing around racial equity and poverty. But we'll start with you, Dr. Jeffries.
Well, certainly, I think the starting point is to acknowledge that race itself as a concept is not real. It's a fiction. I mean, scientifically, race is biologically meaningless, but race is socially meaningful because it's created hierarchy over the last 500 years globally. And it's culturally meaningful because we use race as a stand-in for cultural ancestry and cultural heritage in America. But while race isn't real, then scientifically, racism is very real. And racism manifests itself in these two ways: personal prejudice, personal bias, but then also these systems and structures. We're very good at identifying the personal bias, right? I mean, it's the use of the N-word, it's the hostility, it's 1600 Pennsylvania Avenue, right? And we can see the personal. The structural becomes a little bit harder to see because we're always looking for negative intention. And we know that structural racism plays out even in the absence of ill-intentioned actors. And whether it's in housing or in education, it's all there. I think right now, and as I talk to young people, students, not only at Ohio State, but in school districts around Central Ohio and nationally, and I say, if you want to understand structural racism, all you have to do is look at the last year and the coronavirus, right? Not only the numbers of Black and Brown and Indigenous folk who have been disproportionately impacted by it, either through loss of jobs, loss of employment, or actually catching the virus itself because of access to healthcare, lack of access to adequate healthcare, being forced into low wage jobs and essential jobs. Like, so you have those factors there. But then you say, well, there's nothing anybody could do anything about that, right? It's like, okay, we could do something about vaccine distribution, right? And what we chose not to do is we chose not to take, generally speaking, a color conscious approach to the distribution of the vaccination. Instead, we're playing this colorblind approach. And in that, it's just replicating the structural inequities in our healthcare system, in our transportation system, in our education systems, right? So all of that then leads to those communities that haven't been hit hardest receiving and gaining access to the vaccine more than those communities that have been devastated by it. I'm from New York City. I mean, that's my hometown. I lived in Columbus, Ohio longer than I lived in New York, but I still call New York home. And there, you go zip code by zip code, and you see those communities up on Fifth Avenue overlooking Central Park, are gaining more access, have higher percentages of people vaccinated than those communities up in Harlem and in Brooklyn that were communities of color, Black and Latino, that were devastated. So that's structural racism. Good intentions, good actors. Everybody who's putting a needle in somebody's arm is well-meaning and well-intentioned. They're doing a hell of a job. But the structures in place have led to this inequality. So we don't even have to go back, 20 years, 30 years, 40 years. We can just look at the last few months and we see the way in which structural racism has had a devastating impact, cost lives in the American context.
Yeah, I think we lost Maryland. So I go John to Charles, and I have Charleta bring it home on this question. Institutional racism to you.
Well, so we've been down this road, and we've seen it just here in this community, here in this county. And so, it's something that's been, when I took over the clerk's office back in 2001, I had 240 employees. There were 9 African-Americans in the office when I took over. County government looked like that throughout county government. And it's an institutional thing. Dr. Jeffries talked about Ohio State, and I saw a picture of the board of directors meeting from Ohio State from a couple of years ago. It was a whole bunch of white faces. It's just, you can't, it's structural and institutional racism is something that's this country's been founded on. It's been that way for 400 years. It's been a very, very serious, conscientious, set of decisions that have been made, decade after decade, administration after administration for, generations. And, I think it's a subconscious thing for a lot of Americans. I don't even think most white Americans know and understand what institutional racism is and what it's all about. I don't think it's something that most white Americans ever even considered up until the last few years, because it's just something that is ingrained in them. And now that people are starting to, because I think probably because of the Trump administration, I think this is an issue that's in people's face. I think this is now something that people are waking up to, literally waking up to. And I think that people are starting to understand it a little bit better. And so I think that while all of my colleagues that are on this panel with me today now have lived this you guys have all lived this your entire life. This is something that is something that you guys have all had to, be, as part of your DNA. The rest of the world is hopefully now starting to wake up to some of this. And so, it's something that folks are going to have to continue to be made aware of. And there's just a lot of education. This is something that you, Kevin, you brought up earlier in the panel. And so there's just a lot more that has to happen still. But I think that we're headed in the right direction. And I think that here in Franklin County, I certainly think that we're headed in the right direction. We've been committed to it for the last few years, and we're going to continue to do certainly as long as the three of us are on the board. And we're very committed to making sure that not only county government is is doing this work, but that we're dragging our colleagues in the business community and as well as others in Central Ohio to continue to be open to this conversation and to open to doing the work that's necessary.
Absolutely. Real quick before you, Charles, you go, I want to give a shout out quickly to Joe Mazzola, our Franklin County Health Commissioner. Thanks for being on. Chip Spinning, Executive Director of Children's Services. Steve Renner, Director of our Sanitary Engineering. He says it's a great conversation. This would also be good in the rural and suburbs too. Bethany Carter, Grace Hunter, RJ Young with the National Coalition, and the National Coalition of 100 Black Women Columbus Chapter. So thank you so much for tuning in, Charles. Institutional racism.
So I appreciated your comment and Dr. Jeffries' comment about prisons as a form of institutional racism because it's the most glaring example. Let's not forget that's exactly what public housing was designed for. These young folk were born into prisons. Public housing compounds of poverty were a perfect example of institutional racism. They were horrible. And so that is one of the examples of things that we must correct. You know, I'd be remiss if I didn't say that, but before I go there, I think it's important. I think it's our responsibility now to speak out against what we know is wrong. And I think these kind of conversations give us the venue to do just that. So that's why I highlight the institutional racism piece, particularly in the work that I do. I also think it's important to note that the county, you all, the commissioners, along with Joey Bivens, have made major strides. Look, the Rise Together Blueprint for Reducing Poverty gives over 120 goals and actions that can be taken. If we just did that, if we could just put the resources and the commitment behind the recommendations that you all know, who came from all of our community, I think that would make a huge stride in building the confidence and the education necessary to make real changes in our community.
Yeah, we are, and we measure everything by those standards. Everything that we do, every contract we do, we measure by those standards. We got about 3 minutes. I'm going to let Senator Tavares say a few words here on this topic, and then we'll just go around and do closing remarks.
Thank you, Commissioner Boyce, and to Commissioner O'Grady, and in her absence, Commissioner Brown. Thank you for having this a topic for today's town hall. Racism is real. There is structural racism. There's individuals who are racist, but we've got to go beyond the talking. As the county commissioners have given an example of what they're doing to undo racism, we as individuals have to each do our part. One of the things I want to caution our sisters and brothers who created the Black Lives Matter movement is that it has to be sustained. And be aware of history. Be aware of what Dr. King was attempting to do to bring Black, brown, red, yellow, poor Caucasians together to fight the enemy of racist policies and practices. What the Black Panther movement went through in trying to address poverty and racism, bringing Black, brown, poor whites together. There's always a Judas. If you haven't seen the movie, Judas and the Messiah, go and see it. There's always someone who is going to try and help undo what good people are trying to do. And so you've got to be vigilant. We've got to be vigilant that we can't allow someone to say it's too hard, or it's not necessary, or now is not the time. We've got to stay strong, and we've got to support those movements that are helping to push all of us to undo structural racism, individualized prejudice and discrimination and racism. And then we've each got to do our part, because it can't be done by one person or one organization. Each of us have to do our own cultural audits of our organization to see whether our policies and practices are keeping people down, keeping people out simply because of their race or ethnicity.
Well, thank you so much to our guests. We don't have time for statements, but I will end this way. Give me your one word for 2021 under this topic of institutional racism or the cost of racism. My one word, I'll start it off, is going to be hope. I feel very hopeful and encouraged. Well, this one word, so we'll stay with hopeful. I feel very hopeful that our future is looking brighter. John, what's your one word?
Determined.
What was that?
Determined.
Determined. We got hope, determined. Dr. Jeffries, Charles, and then Charleta.
I'd say action. It requires action on the part of everyone to make change. So action.
Okay.
I go with opportunity. We have one, and we need to take it.
And Senator, you want to bring us home with your word?
Everyone took my words.
Of course.
I would end with sustainable. Sustainable.
Okay. That's a really good word. That's a really good word. Well, I think this has been a really good conversation. I know I hosted a number of these, and so did Commissioner O'Grady this summer. And this is one of my favorites because the feedback we're getting right now from the folks who are watching has been very strong. I want to thank you all for taking time out of your day. It is Black History Month, so I want to encourage you to get a nice book to read. This is one I'm promoting right now. This is a great book. I haven't been able to put it down, about the history of Black banks in America, the history of Black banks in America, and it's very exciting. So get your Black History book get a book for Black History Month, and at least do that part as part of this ongoing legacy and for Black history. Thanks so much for joining us. Thank you, Central Ohio and Franklin County, for joining us today. God bless you all.
Take care, everybody.